Becoming injured due to work-related activities not only impacts our ability to work, but puts us on the sidelines from life's enjoyable activities. By using proper body mechanics, we can lessen our risk for injury.
I'm Laura Coleman, and I'm a physical therapist here in the local area. And physical therapists see a lot of spine injuries. We're here to talk about the anatomy of the spine today, and just a brief overview. We have the cervical spine, thoracic spine, lumbar spine, and then we have the sacrum, which is a triangular shaped bone near the bottom of the spine, and then there's the coccyx, which is what we commonly refer to as the tailbone. On the sides, we have two large bones that we think of as our hip bones, but they are called the ilium. This is the left ilium and the right ilium, so together they're the ilia. And they form a joint with the sacrum, referred to as the sacroiliac joint. What you don't see on the model is the thick ligaments that hold these joints together. The rest of the spine, what you'll also see is the yellow nerve roots that exit at each segment. And each nerve, you have one on each side exiting, and they're exiting through holes called foramen, or foramina plural. And also at each segment you see we have two facet joints on each side, and they allow for movement into flexion, rotation, side bending, and side bending the other way, and extension. The joints in the spine allow us to have this mobility. If we take a look from the front view, we see the discs that are also in between each vertebral body. And the disc functions in a lot of ways, and first of all, it's a cushion, so it's like a large sponge in between the vertebral bodies. And some pathology will happen over time to the disc. We can have degeneration of the disc, and that can lead to certain collection of signs and symptoms. But we can also get injured at the joint level and also at the muscular level. You don't see muscles on here, but we've got a thick, several layers of muscles that cover the spine. What I'd like to talk about briefly at this point is the difference in types of injuries that we see in the lumbar spine. We see anything from acute injuries such as sprains and strains, so sprains of the ligaments that might connect the pelvis together or connect the joints together, but also strains of the muscle that we might be overusing in one incident. So for example, lifting something too heavy without assistance, that might cause a strain. But more importantly is the cumulative effect of certain motions that we might undertake on a daily basis. And these motions accumulate over time along with the natural degeneration that happens to the intervertebral disc as we age. The collagen fibers break down and it just becomes inherently weak. And the wear and tear of repetitive twisting motions can wear down the facet joint cartilage as well as wear down the collagen within the disc. And then one simple movement one day may cause a ruptured disc or herniated disc or a bulging disc. And that's what we want to prevent. We want to prevent the accumulation of stress and strain to the collagen fibers that make up the disc. The last thing I want to end with is the proper alignment of the spine that we want to see, which is a modified S curve. Okay, we have a forward flexion through the thoracic spine, and then we have a little bit of lordosis in the lumbar spine, and then the sacrum comes out sort of in this angle. And that's a normal alignment. What we don't want to see is this hyperextension in the lumbar spine or an exaggerated flexion in the thoracic spine. An exaggerated S curve is not what we want to see, because then we get symptoms from that and it puts us at risk. And then the very last thing is just to note where on the pelvis the hip joint is. Okay? So this hip joint, the true hip joint, is the articulation between the femur and the ilia, or the ilium. So it's a ball and socket joint right here, and it's very important in using this joint for maintaining proper body mechanics. In other words, we don't want to do excessive motion at the spine when we should be doing that at the hip. And we'll talk about that when we talk about body mechanics. So the first part of proper body mechanics is getting proper posture. So we use this dowel or this stick to help educate people about proper posture. So if we allow for a little bit of lordosis here and a little bit of lordosis here that's normal, the modified S curve, then what we want to see is good contact at the sacrum, thoracic spine, and the head. So that's it, perfect. So that is normal posture. Okay? So if we want to maintain that posture as we move, I'm going to leave the stick here for you to give you that feedback. Okay? So let's go ahead and go into a partial squat. And keep in contact, that's it. Good, nice hinging at the hips. So we want to hinge at the hips and the knees, and all of this stays in contact with the dowel. That's great posture. The next step is to maintain this posture while you move and while you're performing in your job.
Proper ergonomics prevents musculoskeletal disorders in the workplace. Avoid reaching, bending at the waist, and twisting. Keep your feet shoulder width apart and bend your knees slightly. Switch hands frequently to avoid repetitive motion injuries. Remember not to twist at the waist. Do not cross over your feet, but shuffle step. Bend your knees and maintain your neutral spine. And count to 3 in unison before lifting. Grip the object with your whole hand, not just fingers. Check your route. Take time to size up the load. Be in sync with your partner. When swinging a wet, heavy mop, remember to avoid bending at the waist, twisting, and swinging the mop in too wide of an arc. This puts unnecessary stress and strain on your spine. Instead, use shorter strokes, bend your knees, and maintain your neutral spine. When stacking chairs, remember to bend your knees and maintain your neutral spine. Don't twist at the waist. When lifting tables, get firm footing with feet shoulder width apart for good balance. Keep your neutral spine, allowing your legs to do the lifting. Twist and ouch. David does a good job lifting with his legs and not using his back. Excellent job, David, but you forgot the can. David is making a hard job much more difficult and will definitely feel the burn later. By bending his knees and allowing his legs to absorb the load, he'll keep in shape to do the things we enjoy after our workday.